I love the music. Listen to your heart. Pay attention to your heart health. With it being National Heart Health Month, we are at the Heart's Desire Bubbly Breakfast and with the Chief Cardiologist at the Abbotsford Regional Hospital. Hello, Dr. Saya. How are you?
Good morning. How are you?
Must be an important morning for you to take time out of your busy schedule.
Absolutely.
Thank you so much. Many people probably have never seen actually what a clogged artery looks like. Talk us through this.
So what we see here, on this side, there is a significant reduction of the blood flow to the target area where the blood should be supplied to, comparing with the other one. So the mechanism of this is actually slightly complex, but it's simply accumulation of cholesterol and calcium complexes here. And this is multiple risk factors can lead to that, including smoking, unhealthy diet, and exercise, as well as family history of heart disease as well.
Let's talk a little bit about the overall symptoms of a heart attack. What are the basic symptoms?
So typically the patients will present with the acute sudden chest pain. He described it as a crushing chest pain, usually retrosternal chest pain. This is not the case for everyone. Usually this is typical for men's. However, women's can be presented differently. Usually women tend to have their symptom slightly less severe and actually atypical presentations. For example, they present with arm pain instead of chest pain. They present with the shortness of breath, jaw pain, abdominal pain, sometimes even feeling unwell.
Jaw pain. I never would have thought of jaw pain. So how severe should those symptoms be? If it's a lot less for women, I would think a lot of women don't even really go to the doctor because they're thinking, oh, maybe I just feel a bit crampy or I feel a bit like I have a flu.
That's a very good question. The problem with the symptom in women's, it could be very unsevere. It could be very minor. And that's why the women tend to ignore these symptoms, and that's why they come late to the emergency where they seek medical attention. And that's why we attend to they attend to receive less aggressive medical treatment.
So if you have any concerns at all, definitely go see a doctor. We're raising money for cardiac care this morning out in Abbotsford, Riaz. For more details on the Fraser Valley Healthcare Foundation, you can check out the website, and we've got more coming up with a couple of nurses just before 8 o'clock on what you can start doing today, Michelle, to improve your heart health. Yeah, thanks very much, Riaz. We're here in Abbotsford again, raising awareness and funds for cardiac care at Abbotsford Regional Hospital. But Bridget, we're talking about heart disease and remaining heart healthy. Really, heart disease doesn't discriminate, does it?
It doesn't. It affects people from all ages, and we see more and more people that are younger having heart disease these days.
So let's talk about kind of how it all starts to fall apart.
Okay. Well, we start with really nice, healthy arteries, and through a variety of reasons, we can develop plaque that sits in the arteries. And what we really want to do is choose healthy lifestyle choices so that we can prevent the blockage which will cause a heart attack.
So we can still start to make a difference in our heart health when it's at these first 3 stages by incorporating as well. Today, people can start to eat certain foods, right?
Yes, absolutely. The foods that we eat make a big difference. Diet is one of the biggest things that we have control over when it comes to reducing our heart risk.
Okay.
So eating more fruits and vegetables definitely is a good choice. Eating whole grains, and increasing our dietary fiber. Eating fish twice a week can make a big difference.
And really, it's all about the oily fish now. Bridget, let's talk a little bit about the factors that sort of will help us limit that heart disease. What kinds of things do we need to be worried about?
So definitely eating well, being active, and living tobacco-free.
Okay, difference between physical activity and exercise. I think most people think it's the same thing.
Definitely, a lot of people do think it's the same thing. Exercise is where you're getting the benefit. Your heart rate's elevating. You're actually sweating. Physical activity is our leisurely, everyday living that we do. Going for the walk with the dog, getting out and doing grocery shopping. Exercise is those things that we commit to every day.
So we need to actually exercise. That's the key. It's all about, again, improving your heart health, Riaz and Kyle. We'll see you again just right around celebrations here, and then, of course, just before 9 o'clock, where we're also featuring a fashion show here at the Heart's Desire Bubbly Breakfast. We're going to showcase some of those spring fashions just before 9. It's such a fun morning here in Abbotsford. Once again, covering the 3rd annual Heart's Desire Bubbly Breakfast. How great is it that Seven Oaks has hosted this breakfast again for 3 years?
It's a definite opportunity, and we've had a great experience, and it's been such a fun time. So we're glad to host it again.
And lots of great fashions presented in the fashion show, which a lot of people come here for. So let's talk about some of the hottest spring trends that we have.
Yeah, so we have Shaylin here from American Eagle, and of course, jeggings and patterns are very much fit for this season, for spring. And don't forget denim. we need to make sure that denim's in your spring season, and always great for casualing up or casualing down, so it's great for Shaylin. So we have Irene here from Clio, and baby pink is very in this season, and lace. Lots of lace, ladies. And this beautiful dress is very stretchy, so it fits lots of body types and very beautiful, and I love the baby pink, so it's kind of that new black.
You look lovely, you look lovely.
And we got Melissa here from Ricky's, and we definitely have the tone-on-tone polka dots, and that is a definite must trend this spring, and we paired it with a very bold blazer this morning, so it looks very great. And last but not least, we have Leanne here, and Leanne is trending with a lot of the florals, but they're going with bigger prints this season, and on a lot of the muted backgrounds. So very great, and also paired with some jeggings, and this outfit is from Le Chateau.
Beautiful. I'll get you to step out here, Tricia, because I want to make sure we see all the other beautiful fashions here this morning. Thanks so much for joining us. And once again, protect your heart for National Heart Health Month. For more details on how you can take care of your heart, you can, of course, check out the Fraser Valley Healthcare Foundation.